This is the MicroLab sponsored doc, role of triple drug fixed dose combinations in advanced glaucoma. So glaucoma is the most common cause of permanent blindness, especially in India, but unfortunately most of the patients are presented with the advanced stage of the disease. So proper medical management with multi-drug therapy is very important in these cases. So in advanced glaucoma cases, the target IOP should be lowered to low teens or even upper single digits so that we can preserve the remaining visual fields. So most of the, more than 60% of the glaucoma patients are multi-drug users. The multi-drug therapy can be achieved using the multiple single agents or combination of double and single agents or triple fixed dose combinations. If the number of drops increases, the chance of the compliance rate is decreased, so dropout increases. Recently, the triple drug combination has been developed in India. The advantage of these triple drug combinations are all the three drugs are in single bottle and a single preservative is used in this bottle so that preservative exposure will be less. So the mode of action is enhances the UV scleral outflow and decreases the aqueous humor production and improves the ocular blood flow also. The currently available triple drug combinations includes the brimonidine brinzolamide with timolol. So the world first published data on Tricept was published in Delhi Journal of Ophthalmology. So patients where the triple drug fixed dose combinations is useful are the ideal candidates are patients on 3 to 4 drugs with separate bottles. If you use the preservative-free triple drug combinations in these cases, simplifies the dosing and improve the compliance and adherence. And also in patients on advanced glaucoma who are on PGA analogs with timolol fixed dose combination and not reaching the target IOP. Because if you use the PGA analog with the timolol, the dosing is once daily dose, but timolol you need to put the 2 times a day. So it's not sufficient. Next, patients using PG analogs along with dual drug fixed dose combinations containing brimonidine timolol or brinzolamide timolol and not reaching the target IOP also suitable for the fixed dose triple drug combinations. And patients on secondary glaucomas like inflammatory glaucomas where PG analogs are contraindicated, in such cases also to achieve the maximum IOP controls without PG analogs, we can use the triple drug combinations. These are the benefits of the fixed dose triple drug combinations. The topic is open for the panel discussion, whether single drug is useful or triple dose or fixed drug combinations are useful.
Thank you, Sudhakar. Any discussion points, sir, before we go to the mic, please. Hand mic.
Hello.
Yeah.
So the basic problem for all patients, especially chronic glaucoma patients, and especially if they are using multiple anti-glaucoma medication, is a washout phenomena. We all understand that the cul-de-sac can accommodate 1 drop, at best 2, and third is a waste. When patients ask me, what if I put more drops? I say you lose 20 rupees for every drop you put extra. So having considered that, the thing is like if you say 3 bottles to the patient, 1 PGA plus 1 combination plus another combination now also is possible. In that case, the patient gets confused. The patient uses 1 drop at a time, then subsequently within 5 minutes they put on. The chance of every medication reaching the eye falls down drastically. Whereas this triple dose combination, it achieves something like in 1 drop, you're getting all the 3 molecules. Plus, it is also observed that especially brimonidine, if it is used in isolation, the chances of hyperemia are more. Whereas the addition of timolol to brimonidine, and especially brinzolamide, it adds to the comfort of the patient. It stabilizes the combination a little bit more better than those drugs being used in isolation. So that is a second advantage. And efficacy-wise, it is good. Like especially patients, you coming with 3 bottles, 4 bottles, you really don't know whether the patients are complying with it properly or not. In such situations, this triple drug combination, at least in my practice, in my private setup, it is definitely working well, and it gives stability to the molecule, and the efficacy is reasonably good. And you have multiple mode. In just 3 drops in a day, you can give maximum medication to the patient. In just 4 drops a day, you can give maximum medication to the patient. Chances are quite good and quite high.
Thank you, sir. KVV sir wants to add a point.
So just like any other medicine, it has its pros and cons. And as we talk about the side effects, because if the patient develops any side effect, we cannot differentiate which drug is giving the side effect because there are 3 combinations. So in that way, we have to analyze and we have to weigh which is good and also thing. But this is a very good combination, especially for chronic cases, especially for the very old patients where they cannot use
So many
regularly
drugs.
and forgetfulness and all these complications can be avoided with this combination.
One more point I would like to add is like we generally don't use this triple combination as a first line of treatment, isn't it? Like the basic management principle of glaucoma is we go step by step, one drug at a time. So you, after establishing the efficacy of a particular drug, then to reduce the number of bottles, then we switch to a triple combination. So that way it works out good. So
Yeah, thank you, sir.
Like sir said, first we have to establish the efficacy of each molecule, and that itself may take more number of visits. So added advantage of the second drop and third drop is not really 100% and add on, but it will be 10% or 2 to 3 millimeter like that. We have to keep those things into our mind.
Yeah. Thank you, sir.
especially in secondary glaucomas, post-operative ocular hypertensions, where the pressures are touching 45, 50 like that, these drugs works well. Like you
Yeah.
have to drastically bring down the pressure apart from the systemic acetozolamide, where PGAs are contraindicated. He showed in one of the slides, especially in situations where PGA is contraindicated. In such situations, to reduce the pressure drastically, this combination has a role.
Okay. Sir, I request Gopal Raju sir to give a memento to Manoj Mathur sir, and I request the next session, that is the refractive cataract surgery panel discussion, Dr. Madhukar Reddy sir to please come out to chair the session, and Dr. Srini sir, Srini Adakalan sir, Dr. Ramesh Bobili sir, Sunil Tangaraj sir, Dr. Gopal Raju sir is already here, Dr. Rajesh is left I think, Dr. Maher, Dr. Veng.